I have three main roles from a clinical standpoint. I'm the inpatient medical director for the rehab unit here at Froedtert. Froedtert's a level 1 trauma center, so we get a fair amount of traumatic injuries, and I do a lot of the orthopedic and trauma rehab, so people that are in car crashes, have broken bones, etc. If they need inpatient rehab, they would usually come to my service up on the 5th floor. That's where our rehab unit is. I also do amputee and prosthetic rehab, and that sort of ties to kind of when I was an undergraduate, I had a mechanical engineering degree, and so that sort of allows me to use my engineering in the prosthetic world, which are artificial limbs, and people that have amputations, lower extremity amputations or leg amputations and arm amputations. And I see several hundred people a year, both as an inpatient and then follow them as an outpatient, and then prescribe their artificial limb, and then prescribe their therapy, and then direct their prosthetic rehab after they get the artificial leg, and then even beyond. So I've seen, since I've been here since early 90s, I have a number of patients that I've been seeing for years, and doing their prosthetic rehab. And then the third part, I do these nerve tests called EMGs, or EMG nerve conduction studies, which it's a specialized type of nerve testing that looks for peripheral neuropathy or nerve disorders or muscle disorders. It's extremely gratifying to see someone in the clinic that didn't have a leg. They had an amputation in the hospital. I saw them in the hospital. They were at kind of their low point, either not able to get themselves out of bed, or they were in a wheelchair but were, wanted to be able to walk, but they weren't able to for obvious reasons. And then I see them in clinic. The first time, they still don't have a leg, but now they're ready to get the leg. They're very excited about getting it. They get the leg, and then I see them several months later. They have a leg, they're walking, and it's amazing. They are so happy, they're so grateful. And I'm thinking to myself that I'm really lucky to be able to take care of someone like this. So the majority of teaching I do is with our residents. We have a residency program, very robust residency program. We take 6 residents a year, and so I do a lot of teaching on the inpatient rehab unit. I have a resident with me that I teach kind of a one-to-one fashion, and then I also have residents in the clinic with me when I have the amputee and prosthetic clinic and the EMG and nerve conduction studies. So it's a lot of resident teaching. I do some didactic teaching with the residents as well when it comes to the amputee and prosthetic module for their didactic series. I also teach the medical students. There's a course on muscle stretch reflexes and manual muscle testing, which I participate in. The thing I really love about the medical college is the amount of collaboration that I'm able to do with other physicians and other professionals and PhD professionals as well. I like to tell kind of the story that I can go usually, usually in any one day, I can probably run into 4 or 5 different other physicians from other specialties, whether it's internal medicine, general surgery, trauma surgery, vascular surgery, orthopedics, rheumatology, and I might be discussing one of my patients, I might be discussing one of their patients. We might be talking about something cutting edge that they're doing that I wasn't aware of. And that happens every day. And I love the variety. Like I said, I love the fact that we can collaborate with other specialists.